Hello, my name is Christopher Garcia. Today I will be discussing an article that I came across in regards to this week's discussion. The article is titled Ethical and Regulatory Challenges of Artificial Technologies in Healthcare. Um, Essentially, this article discussed the increased focus on artificial intelligence in healthcare with recent growth in use of AI in enhanced healthcare operations, and as well as AI assisting in diagnosis and customized patient treatments. It also discussed the challenges that come along with AI as it presents ethical, legal, and regulatory issues, and the need for strong rules and regulations, and as well as guidelines for effective use of AI. It also discussed the transformative impact of AI as it improves disease diagnosis and patient monitoring and personalized patient care plans, as well as a regulatory need that needs to be implemented as well if we're going to go forth with using AI in the future. Good regulation ensures that AI is safe, ethical, and trustworthy. AI should be included as well as AI should be included from not just from a healthcare perspective, but also for the patient as well, as it can be used as a great resource for healthcare education for patients. There should also be some human oversight as well, keeping AI as a complement to the healthcare profession as well as a replacement. And the potential for AI, if used properly, it could significantly improve patient care. But there must be regulatory implementation to possess ethical and reliable healthcare standards. 3 questions that I formulated from this article in reference to this week's discussion are as followed. Question number 1: how can nursing influence the ethical adoption and implementation of artificial intelligence technologies in clinical practice to ensure patient safety, privacy are maintained without compromising the healthcare quality? As nurses, we are essentially the advocate for patient-centered care and ethical standards. This can influence healthcare policies as AI needs to be governed essentially by the nurse. We can't just trust AI and expect everything to go right. There needs to be some advocacy as well from the nurse perspective. And along with that would come the proper education, as possibly even teaching us how to use this resource, teaching us how to use it. So essentially, nursing schools, we would have to implement classes on utilization of AI in healthcare policy and health and patient-centered care. It's pretty interesting, as we're probably going to see this in the future, and just to see the development of it all and how it transpires. I believe this is going to be part of normal practice for nurses, as well as nurse practitioners and practitioners in general. So that's just something to consider. Question number 2 that I came across, or that I formatted, was: what measures can be taken to establish accountability when AI systems used in healthcare make errors? And how should these measures be reflected in the regulatory frameworks? So the use of AI in healthcare definitely presents its challenges in the terms of responsibility and accountability, especially when errors occur. This question considers the need for clear regulatory guidelines that define liability and ensure that healthcare providers are not unjustly blamed for artificial intelligence errors. So that's another topic to consider and further think about if it's something that we're going to use in the future. And the last question that I came across was, in what ways should the integration of AI into healthcare systems be regulated to ensure health equity? And how can these regulations address potential biases in the AI algorithms? So artificial intelligence in healthcare needs to be fair, obviously, but existing biases in the AI systems might lead to unequal treatment. So this is something that we would obviously want to avoid. This prompts a discussion on how regulations can guarantee that AI technologies are equitable and inclusive, prompting fairness in healthcare. The whole topic of artificial intelligence, I feel the use of it is on the rise. It's inevitable. We see it in the cars we drive. We see it in essentially, how we even use our phones nowadays. Artificial intelligence it's implemented in everything we do. I feel that it can be a great tool if used properly. It's kind of exciting to know that we're on the forefront of it, and we're going to see the rise of it, and definitely use it in our practice as future nurse practitioners. So yeah, thank you for your time.